I want you to think about something before I say another word. In the summer of 2022, a 47-year-old man walked into a stadium in Qatar with his teenage son. He was healthy. No known medical conditions. He had traveled thousands of miles for that moment. And 2 hours after entering the stadium, emergency services were treating him for severe heat stroke. He survived. But it was close. And what concerns me as a physician is not that specific case. What concerns me is that man did exactly what millions of people are going to do this summer across the United States, Canada, and Mexico. They showed up, they cheered, and they had no idea their body was sending emergency signals until it was too late to respond calmly. FIFA 2026 is going to be the largest sporting event in North American history. 48 national teams, 16 host cities, 3 countries, more than 5 million people moving through stadiums, transit systems, hotels, restaurants, and fan zones for weeks. I am Dr. Juan Rivera, and this is not a sports analysis video. This is a public health video, because behind every match there are real medical risks that health authorities are actively monitoring right now, and that most fans never consider until something goes wrong. If this kind of information can protect you and your family, I want to ask you to subscribe to this channel right now. Throughout the entire World Cup, I will continue publishing medical updates and health alerts so you can enjoy FIFA 2026 safely and with confidence. Let us begin. Why FIFA 2026 is unlike any World Cup before it. Every World Cup brings its own medical challenges. But FIFA 2026 has a combination of factors that make it the most complex public health event we have seen at a sporting tournament. It is the first World Cup in history organized simultaneously across 3 countries with different healthcare systems, different immigration regulations, and climates ranging from the extreme heat of Houston and Miami to very different conditions in Canada. It is also the first World Cup organized after the COVID-19 pandemic, with millions of people traveling internationally in large numbers for the first time after years of restrictions. And it is the first tournament taking place against a backdrop of simultaneous infectious disease alerts that health authorities in all 3 countries are actively monitoring right now in 2026. Health authorities in the United States, Canada, and Mexico have coordinated their largest public health preparedness effort for a sporting event in the history of all 3 nations. That is not alarmism. It is a signal that public health professionals understand the magnitude of what is approaching, what previous World Cups taught us. To understand why FIFA 2026 deserves special medical attention, it helps to look at what happened at previous tournaments. Each one left lessons that authorities are applying right now. At South Africa 2010, the primary medical challenge was a winter influenza wave that coincided exactly with the tournament. The Southern Hemisphere was in full winter, and millions of travelers from the Northern Hemisphere arrived without adequate immunity to the circulating strains. Emergency services in several host cities reported a significant increase in respiratory infection consultations during the tournament weeks. The lesson was clear. Massive mixing of people from different regions of the world in a concentrated space accelerates respiratory virus transmission in ways that exceed standard predictions. Brazil 2014 presented a different challenge. Authorities developed special inspection tools to evaluate food services in host cities because tropical heat, high humidity, and mass food handling under extreme pressure created ideal conditions for outbreaks of Salmonella, E. coli, and Staphylococcus aureus. Food poisoning affected thousands of visitors, and many of them never reported it because they assumed it was simply their stomach adjusting to local food. Qatar 2022 demonstrated something physicians had been warning about for years. Extreme heat does not respect physical fitness or age. The tournament was moved to winter precisely because of temperatures, but heat-related cardiac problems, dehydration, and physical stress in crowded conditions affected fans of all ages. It also coincided with the end of the COVID-19 pandemic, adding an additional layer of complexity for regional health systems. FIFA 2026 inherits all of those lessons, and authorities are applying them. But the responsibility for protecting your own health and your family's health cannot be delegated entirely to public systems. It begins with information. And that is exactly what we are building together in this video. The most underestimated risk: extreme heat and dehydration. Public health experts and sports physicians advising the health authorities of all three countries agree on something important. Extreme heat is the #1 risk for FIFA 2026. Not viruses, not food, the heat. The reason is specific. Several matches are scheduled in cities that in June and July of 2026 will face severe heat conditions. Miami, Dallas, Houston, Kansas City, Philadelphia, Monterrey, and Guadalajara are the cities causing the most concern among specialists. It is not simply air temperature. It is what physicians call the wet bulb globe temperature, which combines temperature, humidity, wind speed, and direct solar radiation. When that combination reaches certain levels, the human body loses its ability to self-regulate even in completely healthy people. The process works like this. Your body maintains its internal temperature through sweating. When the environment is so humid that sweat cannot evaporate efficiently, that cooling mechanism fails. Internal temperature rises. And when it exceeds certain thresholds, organs begin to suffer damage. The first organ to be affected is the brain. That is why the initial symptoms of heat stroke include confusion, disorientation, and behavioral changes that the affected person often cannot recognize in themselves. Someone beside them needs to notice. The progression can be extremely fast. A person who enters a stadium well hydrated can develop heat stroke in under 2 hours if conditions are right and they do not take the correct precautions. And in people over 50, in people with hypertension, diabetes, heart disease, or kidney disease, that progression can be even faster. The warning signs you need to know and communicate to everyone in your group are the following. Skin that is very hot but dry, which means sweating has stopped, and that is a serious alarm signal. Confusion or responses that do not make sense. Sudden, intense headache. Nausea without apparent cause. Rapid heart rate that does not slow with rest. Loss of consciousness or fainting even briefly. If any of these signs appear, do not wait. Do not sit the person down with water and hope for improvement. Seek medical attention immediately and move the person to a cool environment while waiting for help. FIFA has implemented mandatory cooling breaks at the midpoint of each half in matches played under extreme heat conditions, extended hydration periods, and thermal monitoring systems in stadiums. But those measures protect primarily inside the stadium. The greatest risks occur outside, on long walks from transportation, in uncovered fan zones, in waiting lines under direct sun. My clinical recommendation for anyone attending a match in a hot city is this. Begin hydrating the day before, not the day of the match. Always carry water and do not wait until you feel thirsty because thirst is a late sign of dehydration. Wear lightweight, light-colored clothing. Actively seek shade during waits. And if you are traveling with elderly people, with children, or with anyone who has existing medical conditions, assign someone in the group the specific responsibility of monitoring their condition throughout the entire day. Cardiac and circulatory risks in crowds. There is something that happens in massive crowds that very few people consider from a medical perspective. The combination of heat, intense emotional effort, dehydration, and physical crowding creates conditions that can trigger cardiac emergencies in people who have never had a diagnosed heart problem. The emotional stress of the match, celebrating a goal, the tension of a penalty shootout, the disappointment of an elimination, all of those moments trigger a real release of adrenaline and cortisol that temporarily elevates blood pressure and increases heart rate. In a person with healthy coronary arteries, that does not represent a problem. In a person with partially blocked arteries who has never been diagnosed because most heart disease is silent for years, that emotional peak can be the trigger for an acute cardiac event. Studies conducted during previous tournaments and at major sporting events have consistently documented an increase in acute myocardial infarction episodes on match days, especially during high emotional tension matches. This is not a marginal risk. It is a documented and reproducible pattern. My medical recommendation is clear. If you are over 45 and have not had a cardiovascular evaluation in the past year, have one before the World Cup. It does not need to be an exhaustive evaluation. An honest conversation with your doctor about your cardiovascular risk, your blood pressure, your cholesterol, and any symptoms you may have been ignoring in recent months can save your life. If you already know you have hypertension or heart disease, speak specifically with your doctor about the precautions you should take at mass events with heat. And if you take medications for blood pressure or heart conditions, always carry them with you during the tournament. Never skip a dose because of travel, and know the emergency symptoms that require immediate attention. We are approximately 5 minutes into this conversation. If the information we are building together is being useful to you, I want to ask you to subscribe to the channel right now. Throughout the tournament, I will continue publishing specific medical updates for each week of the World Cup. Your subscription ensures that information reaches you when you need it most. Infectious diseases. What authorities are monitoring? FIFA 2026 takes place against a backdrop of simultaneous health alerts that authorities in all 3 countries are monitoring with unprecedented coordination. Let me explain each one clearly and without exaggeration. Measles is currently the infectious disease causing the most concern among epidemiologists for this tournament. In 2026, measles continues spreading across North America with documented outbreaks in multiple U.S. states, in Manitoba, Canada, and in Mexico, where the number of cases so far this year already exceeds everything recorded in all of 2025. Measles is extraordinarily contagious. One infected person can transmit it to between 12 and 18 unvaccinated people in the same space. A stadium of 80,000 people with travelers from 50 countries is exactly the environment where an outbreak can multiply within hours. The protection is simple and available. If you and your family are fully vaccinated with 2 doses of the MMR vaccine, you are protected. If you have any doubt about your vaccination status, this is the moment to verify it with your doctor. If you are traveling with children over 12 months who are not yet vaccinated, speak with your pediatrician about available options. H5N1 avian influenza is the second concern of health authorities. In 2024, it was detected for the first time in dairy cattle in the United States and has since spread to herds in multiple states. Scientists are actively monitoring for any signal of human-to-human adaptation, which would be the necessary step for a new pandemic scenario. Currently, the risk for the general public is low, but authorities are monitoring in real time, and any significant change in that picture will be communicated immediately. If during the tournament you hear official alerts about H5N1, follow them carefully. Mpox, formerly known as monkeypox, maintains global circulation of clade 2 since the 2022 outbreak. Since 2024, cases of the more severe clade I have appeared in the United States in people with no travel history to Africa. The risk in the context of the World Cup is real, but manageable with basic hygiene precautions and avoiding close physical contact with people who show unexplained skin lesions. The Ebola situation deserves a clear explanation because much of what circulates on social media about this topic is poorly contextualized. The World Health Organization declared a public health emergency of international concern for an outbreak of the Bundibugyo strain of Ebola in the Democratic Republic of Congo, which has spread to Uganda and South Sudan. This specific strain has no approved vaccine or specific treatment. However, Ebola is not an airborne disease. It requires direct contact with body fluids of an infected person with active symptoms. The risk for an average fan attending the World Cup is extraordinarily low. What is real is that all 3 host countries have coordinately implemented entry restrictions for people arriving from affected regions within the past 21 days and have established enhanced detection corridors at major international airports. Those measures are working and are designed precisely so that the risk to the general population remains low. Food and water safety. This is the area where you as an individual have the most control over your own risk. And it is also the area where I most frequently see travelers make mistakes that could have been completely avoided. Food poisoning at mass events is not random bad luck. It is the predictable result of what happens when food services designed for a certain capacity try to serve 10 times more people than usual under extreme pressure and heat. The most frequent pathogens in this context are Salmonella, E. coli, Staphylococcus aureus, and norovirus. Norovirus deserves special attention because it spreads not only through food, but also through contaminated surfaces and contact with infected people. In a full stadium where thousands of people share bathrooms, handrails, and common areas, a norovirus outbreak can spread with extraordinary speed. Symptoms appear between 12 and 48 hours after exposure, which means many fans return home before developing symptoms and never connect the illness to the event. My practical recommendations are the following. In Mexico especially, drink only sealed bottled water or water from certified sources. Do not consume ice whose origin you cannot verify. Be thoughtful about street food vendors, not because the food is necessarily unsafe, but because under high demand and heat conditions, safe food handling timelines can be compromised. Always carry hand sanitizer and use it before any meal, after using bathrooms, and after touching high-contact surfaces. And if you develop gastrointestinal symptoms during the tournament, immediate hydration and rest are the first steps. If symptoms are severe, contain blood, or are accompanied by high fever, seek medical attention without waiting. Special risks for older adults. I want to speak directly to the older members of our community and to the families who will be accompanying them to the tournament, because the risks we have described do not affect everyone equally. After age 65, several physiological mechanisms that protect the younger body function less efficiently. The sensation of thirst decreases, which means older adults can be significantly dehydrated without feeling it. The ability to regulate body temperature is reduced, making heat stroke occur faster and be more severe. The immune response to new infections is less robust, and the effects of dehydration on kidney and cardiac function are more pronounced. If you are over 65 and planning to attend World Cup matches, I recommend making 3 decisions before you travel. First, a specific medical consultation to review your current medications, because several common medications, including diuretics, beta blockers, and some antihistamines, affect heat tolerance in significant ways. Second, verifying that your vaccinations are current, specifically influenza, pneumococcus, hepatitis A, and hepatitis B. Third, establishing a clear communication and response plan with your family in case you experience any warning symptoms during an event. We are approximately at the midpoint of this video. If this is helping you prepare to enjoy the World Cup safely, I want to ask you to share this video with your family and friends who will be attending the tournament. And if you have not yet subscribed to the channel, this is the moment. The information we share here can make a real difference in the safety of the people you love. Safety for families and children. Children have specific vulnerabilities in this context that parents and grandparents need to understand. Dehydration in young children progresses more rapidly than in adults because their body water volume is proportionally smaller and their kidneys are less efficient at conserving fluids. Dehydration symptoms in children under 5 include dry mouth and lips, crying without tears, dark urine or absence of urination for more than 8 hours, and unusual drowsiness. If you notice any of these signs, do not wait for the child to say they are thirsty. Offer fluids immediately and seek medical attention if symptoms do not improve quickly. For families traveling with children, the most important recommendation I can give you is to plan match schedules with much more attention than usual. Evening matches in hot cities are considerably safer for children than afternoon matches. If the match is during peak heat hours, consider whether the experience can be enjoyed at a covered, air-conditioned fan zone rather than in the stadium itself. Medical Travel Preparation Checklist. Let us build together the medical preparation checklist that every person attending the World Cup should complete before leaving home. 6 weeks before travel, schedule a medical consultation and review your vaccination status, your blood pressure, your blood sugar if you have diabetes, and any symptom you may have been ignoring recently. If you need vaccines or updates to existing ones, this timeframe gives you complete protection before the tournament begins. 4 weeks before, organize your medications. Bring enough for the entire duration of the trip plus 5 additional days in case of delays. Keep medications in your carry-on luggage, never in checked bags. Have prescriptions in digital format on your phone. And if you are traveling internationally, research the regulations of your destination country for any controlled medications you may be taking. 2 weeks before, assemble your medical travel kit. Here is what I recommend including: a digital thermometer, oral rehydration salts in packets, which are infinitely superior to plain water alone for treating dehydration, pain relievers and fever reducers such as acetaminophen or ibuprofen, an antihistamine for allergic reactions, a responsible use anti-diarrheal, sunscreen of at least SPF 50, insect repellent, high filtration masks for crowded indoor situations, copies of all your important medical documents including medication list, known allergies, and your primary care physician's name and contact number. Emergency warning signs that cannot wait. I want to leave you with the warning signs that should never wait. Not to see if they improve, not to finish the match, not to get back to the hotel. These are signs that require calling emergency services immediately. Chest pain, pressure, or tightening in the chest, especially if it radiates to the left arm, jaw, or back. Difficulty breathing that does not improve with rest. Sudden confusion, difficulty speaking, or difficulty understanding what is being said. Sudden weakness or numbness on one side of the body or face. Loss of consciousness even briefly. Skin that is very hot and dry without sweating in hot conditions. Extremely rapid or irregular heart rate that does not ease. Vomiting with blood or diarrhea with blood. In all host countries, the emergency number is 911 in the United States and Canada, and 911 also in Mexico. Save that number in your phone, and make sure every member of your group has it saved as well. We are approximately 16 minutes into this video. If you are planning your World Cup trip and want to make sure you receive all the medical updates I will be publishing throughout the tournament, subscribe to the channel now and turn on notifications. Every week during FIFA 2026, I will publish specific health alerts, updates on the diseases authorities are monitoring, and practical recommendations so that you and your family are always informed and protected. Final recommendations. Let me summarize the most important points from everything we have discussed today in terms you can carry with you. Heat is your greatest adversary at this tournament. Hydrate before, during, and after every event. Do not wait until you feel thirsty. Pay special attention to older adults and children in your group because they are the most vulnerable and the first to be affected. Your heart deserves an evaluation before your trip if you are over 45 or have any known cardiovascular risk factor. One conversation with your doctor can make a difference that no tracking application can replace. The vaccinations you already have are your first line of defense against measles and influenza. Verify they are current. If you have any doubt, ask your doctor. Food and water safety is largely in your own hands. Bottled water, clean hands, properly cooked food. Those 3 simple decisions eliminate a very significant portion of illness risk during travel. Always carry your medications with you, never in checked luggage, always in your carry-on, and bring enough for more days than you plan to be away. Know the emergency warning signs, share them with everyone in your group before you leave, and know how to call emergency services in every country you visit. Conclusion. There is something I want to say to you before we finish. Traveling to experience the World Cup with your family, with your friends, with your children is one of the most extraordinary experiences this sport can offer. I am not here to take that joy away from you. I am here to help you live it fully and safely. Because the best World Cup experience is the one you can tell stories about when you return home in perfect health. Health authorities in all 3 countries are working with unprecedented coordination to protect the millions of people who will attend the tournament. Hospitals in host cities are prepared. Epidemiological surveillance systems are active. And you, with the right information and the right decisions before and during the tournament, have everything you need to protect yourself and your family. FIFA 2026 is going to be historic. And I want you and your family to be part of that history in a healthy, safe, and memorable way. Before and during FIFA 2026, I will continue providing health updates, travel safety guidance, and important medical alerts to help you and your family enjoy the World Cup safely. Subscribe to the channel and turn on notifications so that information reaches you exactly when you need it. Share this video with everyone you know who will be attending the tournament. You may be giving them the most useful information they will receive before their trip. Leave your comment below. Which host city are you attending? Do you have any specific medical questions about your World Cup trip? I read every comment and I will answer the most frequent questions in upcoming videos. I am Dr. Juan Rivera. Take care of yourself, enjoy the football, and I will see you in the next video.